Hi everyone, welcome to my first Zoom recording of what I hope will be many. How do I share my screen? Share screen. Ooh, it's a lot. I think this is the one. Oh, there we go. It's weird to put yourself out there. I think I'm gonna put this video on YouTube. It's kind of weird. Like, hi everyone, listen to what I say. Oh, how do I get rid of this thingy? Hide flow panel, hide video. Oh no, that's me. Show video panel. Goddamn. Oh. Okay, well, you know what? I don't care. Whatever. Oh, okay. This is okay. Whatever. There's this little panel thing for me that I can't like get rid of. It's kind of annoying, but I guess it's not a big deal. Okay, well, whatever. Before I lose like the one person that's going to watch this. Oh, fuck, and the keyboard shortcuts don't work because I'm video streaming? Why shouldn't the keyboard shortcuts work? That's weird. Am I just not plugged in? Oh, okay. Well, today I will be doing a model of a biotech drug called Lynparza. Now, maybe some of you guys want to learn how to model biotech companies, but usually you can just start with modeling one drug. It's actually quite difficult to model a whole company. You have to start drug by drug, or just do the largest drugs. Usually that determines share price. Okay, well, I'm going to do Lynparza today, and I'm going to bring you guys along because it sounds fun. So this is a good format for you to have just for yourself. Lynparza, generic name, olaparib. It's a type of chemotherapy, I believe. I actually haven't dived too much into this. And it's a Merck drug. So actually, let's do Merck financial statements. You might be wondering what kind of credentials I have to even talk about the models I do. And the answer is, I don't fucking know. I'm just live streaming or making a video. If you want to listen, you can listen. All right. I have like 1,000 of these models. I usually just take the format from another one of my ones. Here, yeah. Okay. And I think I will do a couple more of these. So if anyone ever wants to follow along and learn a little bit about biotech modeling and whatnot, and just the biotech space in general, it'll be fun, I think. If you look closely, you probably know who I take inspiration from when it comes to like biotech modeling. Okay, so we have total revenue, whatever. And I am pretty familiar with biotech space, drug development. I do have my own biotech startup. I used to work for a biotech investment service. And then before that, I worked at a different investment service. You can probably find me on LinkedIn. All right. This is 2016. It's hard to talk and think about this at the same time, gosh. All right, what I want to do is I'm trying to look at Merck right now. And this is a drug that I believe Merck licensed from a different pharmaceutical company. So instead of doing a lot of info gathering, I'm going to just look at their financials first. Because I don't even know how far back Lynparza goes. I think there's a generic already. I really have no idea. I don't look at chemo drugs a lot. Lynparza, okay, so it's not in the 2016. When did they acquire? Sorry if this is boring, honestly. I just thought it'd be fun. Here, you know what? Lynparza. 2020. Must be earlier than that, yeah. Okay, 2014. MSD. What's MSD again? Oh, what? Okay, Morgan Stanley. Now, I'm no expert, but if you want to watch me, feel free to. It's interesting. Oh, so I guess Merck has royalties. Ooh. Do I even want to do this drug? Let's see. Develop, co-develop, co-commercialize. In 2019. In 2019, I see. In June. That would be the third quarter. Oh, so this is like pretty crappy revenue from Merck. Well, it's worth taking a look. I mean, let's see if there's anything Q2 2019. No, so we'll just look at Q3. Oh, okay, there's a ton. Oh, okay, so gross profits of these product sales generated through monotherapies or combos are shared equally for all development and commercialization costs of Keytruda income, whatever. Upfront payment of 1.6 billion. Oh, it'll be fun to see how much Lynparza is actually worth net present value. See if it's something close to that. Blah, 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 something. July 2017. Okay. That's cool. So it seems it's 50-50 split because Merck shelled out a one-time payment for them to do that. Okay, maybe it's an investment. Cool. So for economics, I would do, oops. I think AstraZeneca is AZN, I'm not sure. 50% AZN, 50% Merck, MGK, MRK. Okay, good enough. Oh, let's use this one. Okay. Lynparza. Lynparza. How much money will you make? Let's see. Alliance revenue, Lynparza, US 66. Okay, so this is June 2Q19. 2Q19, Lynparza. Here, something I like to do is I like to freeze this. Oh, it's in view. Oopsies. I haven't done one of these in a while, actually. Okay. So Q219, Lynparza, 66 million, 45 million. Is Mark really doing 50-50? This is an okay drug, I guess. 66, 45, and you can do equals this plus this. Okay, so total revenue is at 111. For something that launched in 2014, that's not that impressive at all. Okay, worldwide sales, 11, whatever. I guess it's important to make sure the alliance revenue is correct. Although 222 in 1 quarter, you multiply that by 4, that's like 800 million, almost $1 billion. Okay. Not quite a blockbuster, but it's busting something. Okay, whatever. I just wanted to see what the revenue looked like. Wait, no, I just did. 71, 53, 123. Actually quite kind of important to look at what else they say in the 10Qs. So when I go through these, I like to kind of quickly skim. Lynparza, ADP ribose polymerase inhibitor, okay. So kills the cell, whatever. All the chemotherapies do that, just one different method of killing the cell, I guess. We will look into that later though. That's important. It's not interesting if you don't know how any of these things work. Okay, received approval, ovarian cancer, 2018. BRCA mutations, okay. There's no recent news. I can look at the trials later. Boop, 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 boop. Okay, well, let's look a little more closely at this merger, or not merger, co-development. Gross profits shared equally. Okay, 50-50. Okay, that's great. We've learned things about Lynparza that we did not know before, so that's great. Sorry that my first drug is a chemo drug. Usually something like an antibody therapy or a PD-1 is pretty interesting. Chemo makes a decent amount of money, but it's not something like rituximab where you just see like fat buttloads of money for a treatment that you didn't know was helpful. Okay, so 269, 176. Now, I really am no expert. Or, you know what? Gosh darn it, yes, I am. I'm just trying to be humble. It's not really something I'm good at, though. I'm working on it. All right, I see. Let's see if there's Q1 revenue, because you can't get Q4 if they do this thing where they add up a whole year. Q1. Lynparza, oh Lynparza. Oh, okay. Where art thou, Lynparza? Uh-oh, maybe there. It's not there. Oh, maybe it is there. 50 and 29. Okay, well, that looks like normal revenue. Oh, now that I know Lynparza revenue actually exists in a decent timeline, I think I will go back to doing a little bit of research, which is, good for whoever's watching because the research part can be more interesting than typing in numbers sometimes. So we'll look at indications today. I recommend drugs.com. I think they do a pretty good list. It's pretty comprehensive. What's this? Oh, the approval. Okay, so the way I like to do indications is we'll start with this one. Ovarian cancer with BRCA plus. BRCA plus is when the BRCA gene, which is a cancer susceptibility gene, it mutates and then you get much higher risk for cancer. I think one famous case of BRCA is when Angelina Jolie, I think everyone's like heard of this one. Angelina Jolie cut her boobies off because she didn't want to get cancer. And she removed her ovaries as well. Okay, whatever. Advanced BRCA ovarian cancer, that makes sense. Maintenance, so adjuvant treatment. Who are in complete or partial response to this chemotherapy. Beep boop bop beep beep boop bop beep beep boop bop beep. Ovarian cancer. Okay, I will stop making noise. I feel like that's annoying. Okay, so in ovarian cancer expansion is basically what they approved it for. Fourth line. This is where I'm getting the fourth line from. Let's just do recurrent here. It's not technically refractory. I mean, these small details, like, they're important, but don't freak out if you don't in the first go around, especially if it's one drug in one company. Of course, the details are important though, so try your best is what I'm getting at. It's breast cancer. Oh, it is. At one point, you just have to stop writing ovarian. Too much ovarian, too much cancer, bro. Here, PRC ovarian, current ovarian. If anybody else is looking at your model, they understand it's ovarian cancer. It's not ovarian, ovarian, I don't know, river infection, you know what I mean? So chemotherapy drug. Ovarian dengue infection. And maybe one of these days I can also talk about keyboard shortcuts a little bit. It's pretty useful. I have one of these bad boys for when I do modeling. It's just easier to type in. I like the click clack sounds that it makes. And also one of these. Cancer, that's a good indication. Took long enough, 5 years. Okay, well, these are all the indications, so let's look at the dates. 2014, ovarian, August 3Q17, ovarian. I have to go over these indications again later because they're a little bit messy. Sometimes indications that do all types of different mutations and then germline mutations. It's better if I can look them over a little bit later. Trying to keep this a little bit entertaining though. All right, 1Q18. Oh, okay, 1Q18. MBC. 4Q18. Maintenance ovarian. 4Q19. Did I just type maintenance ovarian twice up there? 4Q18, 4Q19. Maintenance, PRC, maintenance, first line maintenance. What's the difference? Oh, I guess one's germline, one's not. I see, okay. 4Q18, first line maintenance. Okay, I'm going to guess this is not germline. So I'm going to take this out. Again, it's important to check these over later. But I'm going to, just for the sake of time and entertainment's sake, go over these a little bit quickly so you guys can see the structure more than some finite detail like germline or non-germline. Now we have the timeline, right? I'm going to skip MOA for now because you can look up MOA on Wikipedia. PKPD can do, what is this drug called again? Lynparza. There's the FDA label. Go to here, olaparib. You want to look at the PKPD. Usually there's not a lot of pharmacodynamics. Sometimes for older chemotherapy drugs, they understand how it works more. So there's more pharmacodynamic writing on the FDA label. All right. AUC increases proportionally as it does usually. Time dependent, mean accumulation, steady state following a dose of 300 milligrams twice daily. Q2D means taken twice daily. Steady state is SS. Cmax is 5.4 micrograms per milliliter. Maybe I'll do like a lesson explaining what these words mean. It's not super important for when you're modeling a drug that's been on the market for 5 years. It's more important when it's something in the pipeline. Okay. Oops, CMAS, bro. What the fuck? Hello, where's my beloved microgram symbol? God damn it, whatever. Watch this be like, worst investing video ever. Didn't learn anything. Young girl curses at her screen. I hope this brings some type of value into whatever else is on YouTube. The weird thing is I'm just a normal person. Like I never thought I would put anything on YouTube. I hope somebody watches. It's more fun to do these models when you can talk to an audience. It takes a little bit longer too because I'm thinking about things I want to talk about and also what the AUC is, which is apparently for one dose. Let's see what the half-life is. Okay. 14.9 hours. Let's do plus minus 8.2. %. Binding. That's a pretty average number for a chemotherapy drug. You know, pretty good. Yeah, okay, enough of this, all of this pharmacodynamics, co-kinetics. Yeah, Like I said, usually there's not a lot of codynamic data. Here, nobody cares about cardiac repolarization. Nobody. Sometimes you can look at the dynamics somewhere else. Okay, IP. IP is something I'll save for the 10Q. ASP, WAC, okay. So for WAC, anyways, if Excel decides to work, my computer, this older computer that I have, but really love, is running out of space. I think I have like, I really have no space left. It's really sad. Oh, God damn it, this fucking Microsoft Excel file. Well, maybe I'll force quit. Anyways, what ASP and WAC are is ASP is average sales price. WAC is weighted, whatever. I'll let you know when I remember what WAC is. But WAC is list price. So it's the price that you pay if you don't have insurance. It's the market price basically. And ASP is what insurance companies pay, which is usually at a discount to what the consumer pays. And these deals are usually negotiated behind closed doors. But it's important for modeling. Now, it would be even nicer if it actually came up. But if it's not going to come up right now, then I can do this tomorrow and show you guys. Oh, anyways. Yeah, it looks like it's not coming up. I'll just show you guys tomorrow. I don't want to spend too much time looking at this and wasting time. Yeah. Okay, so regimen. Once again, that's on the FDA label. So you look at regimen, what's there? $300 Q2D. And that is for everything. Okay, so an average patient probably takes it a bit less than 2 years. 300 Q2D is basically what they're going to do. That's quite a lot of milligrams. I wonder how much this drug costs. Probably like in the 80K range, maybe a little less, a little more. Yeah, whatever, okay. We know it's 300 mg Q2D. Oopsies. Manufacturing. I have a weird way of looking at manufacturing, but let's do it. So Lynparza manufacturing EMA. Usually the EMA label has really good manufacturing data information. Let's just look at this one. Nope. I don't think it's this one. Sometimes there's just no manufacturing data, and that's okay too. You can imagine how it's a small molecule, so it's probably some kind of powder packaged in, and then you take it orally. Lynparza recommended for approval. What time is it? Oh shit, it's 12:22. Lynparza manufacturing method. Oh, look, it's the EMA. I love the EMA. They always have good manufacturing info. 58 matches. Oh, okay. Okay, look, melting of LMG. That's specific enough for our needs. You know, one day we can talk about the processes that go behind large scale manufacturing, but today doesn't feel like the day. It's 12:20. Usually manufacturing costs are like 9% of income when it's a small molecule drug. So usually something you can take orally. Clinical batches, polymorphism. Yeah, basically melting of LMG, mixing it in and cooling it, packing it. Small molecules aren't too hard to manufacture unless they have like some tricky chiral center or they're unstable when it comes to chirality. Sometimes you want one stereoisomer, so like one formation, but sometimes the molecule wants to stay in this formation, things like that. Okay, well, you know, I think we did a good introduction tonight, so thank you. If anyone's watching this, you know, I hope this becomes an actual series, or I don't know. I'll see how this does. I'll try to do a more interesting drug after I finish up Lynparza. I'm going through Merck right now. But yeah, thank you guys for joining, and I will see you guys next time.